Hello, my name is Jasenia Figueroa, and I'll be talking about how ADHD is being overprescribed for children. ADHD is a mental illness disorder which can begin in early childhood and last up until adulthood. I would like to mainly focus on the young child stage up until they become teenagers. Treatment for ADHD varies depending on a child's origin, problems, and diagnosis. Controversy always surrounds the ADHD diagnosis, with some belief of normal behavior, while others believe of the psychological basis for severe symptoms. Stimulant medication is a widely used practice to treat ADHD. According to Strauss, research has shown that over 3,000 people with ADHD have been prescribed with stimulants. While millions nationwide use stimulant medication as a solution to treat ADHD, the health complications and drug overproduction is becoming a problem. With people lacking knowledge of the misdiagnosis of ADHD, short and long-term effects of stimulants, and alternative treatments, they fail to realize that children are now being over-medicated with ADHD medication. While many critics contend that children are being over-medicated with stimulant medications, others disagree and believe ADHD medication is necessary in order to control the diagnosis. Stimulant medication is used to control the diagnosis, but it can cure the child's attention, behavior, and symptoms. It has also been proven that ADHD medication makes a massive change in a child's safety, academic, and social skills. According to a 2015 research, Pinker 2015, concluded that over 710,000 Danish children ages 10 to 12 years old with ADHD are far more likely to be injured compared to any other children. It also makes a slight decrease to the amount of visits to the emergency room. Teenagers that are usually diagnosed with ADHD take medications such as Adderall, Evance, and Concerta. It has also been shown that teenagers taking ADHD medication, it reduces the risk of sexual transmitted diseases and other health complications. According to a 2015 research by Pinker, found that teenagers taking ADHD prescribed medication has a 3.6% reduction in sexually transmitted diseases and a 2% reduction in teen pregnancies as well. Many also believe that the earlier you treat your child, the better the social and academic skills they will have later on in life. The earliest age children are being treated, showing signs and symptoms, and tested is as early as the preschool level age, which is 3 to 5 years old. However, many critics argue that ADHD medication is necessary to treat it. It was referenced that when treating children with ADHD, behavioral therapy should be the first source of treatment. This results to why ADHD medications should not be used as the first source to treat disorder. There should be more research in ways to better our child or children rather than popping a pill into their mouth. Now, during the past 2 decades, the number of children in the U.S. taking prescribed medication for attention deficit hyperactivity disorder has increased rapidly. Today, over 3 million children in the U.S. are now taking prescribed medication. Because of this sudden increase between the past 2 decades, it has led to the trend that ADHD is being misdiagnosed for children. ADHD is often mistaken because of how widespread the disorder is and the many norms of child's behavior. ADHD is a mistaken diagnosis for children that lack discipline and maturity. According to the Sanford 2012, in a 2010 study in the Journal of Health Economics, it was estimated that this mistake could account for 20% of the current ADHD population. which is about 900,000 children, according to his estimate. Another potential reason that can explain the misdiagnosis is not having the correct history of a child and the proper examinations needed for accurate diagnosis. Now, to prevent these mistakes from occurring, pediatricians need to have better training with diagnosing and prescribing medications. This is so a child will not end up being mistakenly diagnosed for an illness they do not carry. There also needs to be better monitoring on the individual who monitor and can provide insight on a child's behavior. With these little mistakes being fixed, it can cause a dramatic increase for the amount of children who are mistakenly diagnosed. Though certain children are accurately diagnosed and may need to take ADHD medication to treat the disorder, rather than continuously assuming medication can correct every kid, other alternative methods should be tested out firsthand. Now, when a child is first diagnosed with ADHD, he or she is normally treated with stimulant medication. Stimulant medication is a widely used treatment for ADHD. Many people tend to ignore the fact that there are other alternative treatments to treat it. The seeking problem seems to be that there is obvious over and under treatments. In the article, Are ADHD Medications Overprescribed? Sanford Newmark found a study in the Reading Medical Journal that 64% of children with ADHD have substantial improvement in their symptoms when certain foods were eliminated from their diet. Omega-3 fatty acid supplements and the elimination of sodium and zinc has also shown to improve severe symptoms. Neurofeedback training is one of the alternatives suggested for ADHD diagnosis. This is a non-invasive approach like fitness training for the brain in 2018. With this treatment, a brain map is included, which locates the specific areas of the brain that need help with functioning more effectively. There are plenty more alternative treatments that keep the child out of danger and the complicated side effects with taking stimulant medication. From stimulant medication being such a strong medication, it comes with many side effects. Some side effects are sleep problems, decreased appetite, delayed growth, headaches, and stomach aches. Rebound, where medication wears off, moodiness and irritability. Now, many people tend to not pay attention to the degree of this medication and how it can impact you. A child's personality drastically changes. There was little to no research on the long-term effects of taking ADHD medication, but one major problem is possible lead of abusing the ADHD medication, which can turn into a possible drug abuse. There are many problems with the drug solution for troubled kids, beyond the fact that the approach is on shaky grounds. First, there are risks to taking these drugs years after year. Today in the nation, over 3 million ADHD offsprings are now taking ADHD medication dealing with short-term effects and possibly long-term. Now, from the lack of knowledge of the ADHD diagnosis, doctors are misdiagnosing patients and parents know so little information, which is why ADHD medications are being overprescribed. With the lack of knowledge, kids are now being misdiagnosed, overprescribed, and facing the short-term effects of stimulant medication. Now, not every kid has ADHD. This is what America needs to realize. Instead of over-medicating our children, babies, there are alternative treatments out there. Stimulant medication should not be the first and only. And that was my research and my presentation. I hope you enjoyed and have a great day. Thank you.